earlier that we would have done differently, challenged perhaps, asked more questions. So that's really what we're trying to do in building a platform for patients, just to help them feel better prepared and better educated to advocate for themselves.
So give the audience kind of an idea of how the platform works. But where does a patient start when they're entering into the MyStoria platform?
Sure. So what we're trying to help patients do is to centralize all their information, their symptoms, their medical records, everything applicable to what they're doing. And so what we do as they onboard onto the platform is they go through a very extensive questionnaire so that we can better understand their background, medical health, lifestyle factors, symptoms, previous medical treatment.
Concierge and was an audio lag.
There's an audio?
There was, not a lag, it was just the audio didn't go properly. Now there's audio. But
So just re-explain.
Yeah, start from the beginning if you don't want.
The beginning?
Like introduce ourselves all over again?
Sure, I would say so.
Okay.
I would say so.
Okay.
And that camera's
Should
standing.
that mic be closer to Meg? Because I think the audio is lagging when she was talking.
Okay, you can try.
Is it me?
Okay, sorry.
That's okay.
This is full of technical glitches, my apologies. So
Always.
go ahead, tell us about who you are.
Sure. So Megan Kay, I'm the head of marketing at MyStoria. I've been in tech marketing for about 15 years now, and was looking for a new challenge and a new opportunity. And I met Jess Chalk, who's the founder of MyStoria, and we just connected over our fertility journeys that we both had challenges through. And yeah, really just kind of bonded over the shared mission to help other patients. And so that's why I'm here doing what I'm doing.
My name is Carly. I'm head of Concierge Services at MyStoria. I've been a nurse since 2006 and doing fertility nursing since 2018. Jessica found me. She knew me as a nurse and she liked what I brought to the table and liked how I communicated with patients and thought that I would be a great asset to this team. And that's what I'm going to do through MyStoria is I'm actually going to be able to personally speak with people, help with people, look over their assessments on the platform and help them advocate for themselves and kind of be able to go through this stuff and say, okay, I think you should ask your doctor about this. I think you should ask that. So hopefully they'll learn more about their journey, about their own health and have a better outcome by advocating and pushing themselves for more testing, looking at root causes, all those things.
And it's, from my perspective, kind of a shame that patients have to advocate for themselves. Because I've always looked at that as, that's my job, right? Like my job as a fertility specialist is to advocate for the patients. But so often, and part of the reason we started the show was because we found like that wasn't happening. People were getting, sort of misinformed or ill-informed or not informed at all. And so they do have to advocate for themselves now, but it's a shame because that's the physician's job, right? That's the physician's role. So MyStoria allows people to kind of upload their history. And from that, you can then kind of guide them and other people can access. So tell us a little bit about the platform.
Yeah, so patients can onboard through the platform and onboarding is going to consist of doing like a fertility questionnaire. And it's asking about like all different areas. And they can also upload their own medical records if they have them, or they can fill out an authorization form and I can do that for them and get them and sort them and upload them onto their timeline. And then once they're onboarded, they'll be able to sort of see their journey, see it laid out in a way that's more easier like to digest for them. And then they can also access me through the concierge services and my team. And we can kind of go through that questionnaire and look at their symptoms and everything and say, okay, this is what I think you need more help with. Also looking, if they want to look at stuff mid-cycle, maybe they're good with the onboarding, but now they're about to do a cycle, they need more help, they're confused about how it's going. I'm able to help them through that process as well.
So kind of like guidance in addition to what they're getting from their clinic, because sometimes they're just not getting enough.
Yeah, and I really like how it's personalized information, personalized education and insights from all my experience and what I know. And if I don't know the answer, I'm going to help find you the answer as well, or find you the important questions that you should ask, that I would ask if it was me.
And then does this help build a community for patients as well? Like can they communicate to one another on the platform?
Yeah, so we also have a community feature within MyStoria to help patients be able to find a community, find other people like them going through the same situation. And, we're not quite live with the platform yet, looking to go out early 2025, but we do have our community up. So if you join our wait list, you can get in there now to connect with people to get a bit of a flavor of what we're doing. But we're seeing great questions in there already, people connecting with each other. It's just giving us some insight too into, really what our patients looking for. Of course, they're going to their clinics, they're asking questions, they're getting information in the clinic, but people don't remember, right? You go home, you maybe retain 10% of what you've learned. So there's a lot of, I'm sure you get lots of calls after hours with things that you clarified for people, right? It's just the nature of education and learning and how people retain information, right? So they go home and don't remember, didn't retain what was said, so they want a resource, a reliable resource, which is part of the problem, right? A lot of people right now turn to things like Reddit or Facebook where there isn't legitimate medical trained personnel who can answer questions or intervene if something's happening. So that's part of a challenge we're trying to solve too.
So how does the concierge service kind of look at each an individual case? Is it the nurses such as yourself going through it and then you refer to physicians, or kind of you guide patients to go back to their doctors and ask specific questions based on what you see?
Yeah, every case is individual, right? So I'm gonna look at it and say, okay, what does this person need to benefit from? What can I do for them? So sometimes it might be, okay, I really think that you need to ask these questions. And I've already helped some people where they said, I would have never even thought to ask my doctor that question until you brought it up.
Wow.
And that's the thing, is how do you advocate for yourself when you don't even possibly know what you could ask or what you should ask?
Right. That's
sort of a part that's missing. So I can really help with that, and I have. And for some people, it may be maybe you need to go look for a second opinion at this point, and you have that right. Doesn't mean you need to stop going to your current clinic if you don't want to, but maybe you need to start asking some different people. For others, it may be you might want to expand your care team. Have you thought about integrating, a naturopath? I really think you could benefit from personalized nutrition and supplementation, because you're going out there and buying every supplement on the shelf. You don't need to do that, right? That's a waste of money. There's these targeted ads out there, and you don't need to do that. You need an individualized approach, and that's what people need. They don't need any more cookie cutter medicine. They need to find out what works for them and their body.
Which is what I loved about it, because I'm a huge believer in individualized medicine and making sure that the care is applicable to the actual patient involved, rather than everybody gets the same thing, which is the cookie cutter. We always say on the show, we're making babies, we're not baking cookies here. So I love that, because it's very aligned with what we believe. And I think part of the reason we've grown as a clinic and as a brand is because we do only individualized care. We don't believe in treating everybody the same. And it doesn't actually biologically even make sense. I mean, we know in almost every field of medicine that it's becoming personalized, but for some reason, the fertility world is just lagging. So I think this is a great opportunity for people to be able to connect with, yourselves in this platform, and then get more care than they otherwise would. It's kind of almost like having an electronic fertility coach, which is what I love about it. And then you've got the people behind it too. So what's the sort of implementation of MyStoria? Where are we? When is it going to be ready? How do people learn about you? Where do they go to get started?
Yeah, well, first of all, you can join our wait list now. We'll be running some promos and some exciting things for the people who are on the wait list to get early access. But things are shaping up well. So we've got some early testers in now, working through some of the bugs and making sure that, we're putting together a product that will be valuable to people. We've got about 10 people in there right now that Carly's been chatting with and have gone on and done their health assessment and have centralized all their information and got all their medical records in. And so far, Carly and her team have been able to help a lot of people. So just with kind of 10 early people in, we're seeing a lot of validation in what we have built. So the next round, we've got a few of our ambassadors that will get in there to give it a test, and then we'll be going live very early in 2025.
Oh, that's awesome.
Mm-hmm. We're excited.
And then for the patients who are planning to use it, is like, how is this structured financially for them? There's a fee, it's a
Yeah, we've got
subscription.
it set up as a monthly subscription fee, or you can do it annually for an additional discount,
Sure.
whichever works better for you financially. But we certainly want to give people access to something that is accessible. So both, obviously, just accessible from being able to get it on a device, where we know a large amount of the population can't get to fertility clinics, can't get to coaches, can't get to certain healthcare professionals. So that's part of what we're trying to solve, but also, financially, fertility treatments are extremely expensive. Not a lot of us have coverage. Some of us are doing things like mortgaging our houses and, selling cars and whatever we can do to afford to try and have a baby, right? So we're trying to do everything we can to put an affordable product out into the market.
And that's, it's interesting that you say that, because again, as a fertility specialist, I know people are really putting a lot of their lives on hold, or, like you said, mortgaging it in order to be able to afford this. And so it puts a huge onus on us to be able to provide exceptional care.
Mm-hmm.
And I think having something like this can be instrumental in getting from kind of average to exceptional, because when you have another set of eyes looking at it, and you have someone helping you, guiding you, offering that concierge service, it can actually be really tremendously valuable to take you from getting the 50% success rate you're going to get to that 70-80% success rate, because you're looking at dotting every I and crossing every T. And I think that gets lost. A lot of the fertility world is driven now by venture capital, private equity, and I certainly don't think any physician ever goes into this anticipating they're not going to provide the very best level of care.
Mm-hmm.
But there are financial realities involved with, fertility when it's owned by a company versus being owned by doctors that are really trying to provide the very best level of care. And again, even when it's owned by doctors, it's a big business. So we have a huge moral responsibility to provide the best care, but you find all too often across North America, really across the world, some of that's getting kind of lost in the shuffle. You mentioned that you've already had some people onboarded, which is great, at least for testing. Tell me a little bit about your experience with that, Carly, and how things have gone so far.
It's been really good. Actually, speaking with some people, who've been able to express to me, this is my history. I've done these cycles. This is what I'm doing now. And I've been able to look through their stuff and have appointments with them and say, ooh, you know what, you might want to ask your doctor if you ovulated on your last IVF cycle, because looking at that cycle and estradiol and LH levels, that's exactly what it looked like to me. And sure enough, that person went and asked that question and said, I would have never asked that if you never told me. And they get to do another cycle and their meds are going to be paid for because of it.
You're making a huge change for someone there, right? Like, that's the difference between another 10, 12, 15,000 bucks. That's huge.
It made a cycle accessible for this patient to be able to do, otherwise she would not have been able to go.
Yeah.
I've also picked up on a few other symptoms that I've encouraged them to advocate about. They're in the middle of the cycle right now, and I said, okay, I have all the hope for you and sending all the positive vibes for this cycle. But my job is, what comes next? What else can I think of for you? What else can I advocate? How else can I help you just in case? Like, what could be a plan B for this? So already I've brought up those certain symptoms and said, I think you should ask questions. If this cycle doesn't work, I'm concerned about some endometriosis possibly that hasn't been brought up. So I'm waiting to see how that goes, and I will help them however I can advocate for that and for better care. I had somebody else as well who called me, and through them telling me what was going on, I was able to pick up on there was an error as well in their protocol when information was supposed to be sent to them. So I was able to say, okay, this is what I think you should do. These are the types of people that you need to send emails to, and I think it's going to be okay. I think they will pivot by doing this, and don't worry, because it's very stressful.
Yeah.
This person was out of the country at the time. So thinking that, you were told one thing and that your entire cycle might be ruined even though you communicated something to your team in advance. It's very scary
Yeah.
for someone. They were looking up flights, like would have lost a ton of money. So like, it's okay, based on the medications and what you're telling me, just do this. And they were able to do that, and everything ended up working out. So I was happy that I was able to be there for them in that moment, because I can't imagine the stress. You know, you're already under an enormous amount of stress, and these types of things just make it that much worse.
Yeah, it's great, again, having that resource of having, you know, somebody else there to back you up as you go through these very complex and as you mentioned, like incredibly stressful journeys. It does really help provide that extra sort of shoulder to lean on. And that way people have a much better experience as they go through it. I think that's phenomenal that you picked up stuff that, you know, people should have picked up on already from the physician or you know, fertility nurse side of things, and providing people with that detail, because like saving someone $15,000, that must make you feel pretty damn good, right?
Yeah, I was pretty happy about it. I like to say that I'm trying to teach people the language of fertility. Every medical field has its own language, and we're used to using certain terms and talking in a certain way all day long. But when you're a person who's beginning a fertility journey, it's like, what are these people talking about? What's happening? You know, what was their background? What did they learn growing up? Like, some people don't even know what day one is, you know? So it's like, if I can help teach them this language a little bit, I hope that when they go into the clinic, they feel more empowered, and then they're getting better care, they're asking better questions, and it's just helping really support the team at the clinic too. It's like, I can help answer all these questions so you can talk about even more important stuff, and they're understanding when you're talking about the actual treatment in the clinic and what's happening in the results. They can actually understand what you're talking about.
How has your response been from the doctors you've communicated with? I mean, obviously we know my response, but how did you find the response from other doctors you've chatted with?
You know, when like I was at the ASRM conference, and everyone that we spoke to, we got a really positive response. I think when people understand that we're really here just trying to support the patient, help them get better care at your clinic. Like, we're not trying to compete with you. We're saying that anyone's not doing a good job or anything. We're trying to bring everyone in fertility together so that we can move, you know, care for women forward in a better way, that everyone, it should make everyone better all around, you know, and that hopefully it can take a little bit of pressure off the clinics as well. So we can just help provide that extra support, you know, and you're not getting maybe 30 extra phone calls when you need to deal with these 10 that are really critical, that only you can answer. Like, I'm never gonna answer anything that I can't. Like, if I know that a person needs to talk to the doctor, I'm gonna tell them, you need to call your clinic right now. Like, this is what you need to do. That's how I wanna help support.
And how does it work for someone that, for example, wants like a second opinion? Can they sort of access doctors from this, or can doctors access their profile on there if they give them permission to? Is that something we're looking at in the future, or?
Yeah, I think those are all considerations, because especially giving doctors the ability to see the summarized, succinct information
Right.
is definitely going to be really important, and I think where the clinics see the value. You know, we've got another one of our early testers, for example, so we got all of her medical records. Well, there's 800 pages. So 800
pages?
There's a few blanks in there, but
There's a few ways.
there's a few blanks. But if you're this patient's fertility doctor, well, unless you have an incredible memory, how are you retaining the information you need to remember to properly treat this patient, right? So ultimately, what we would like to do is pull all of the very important information from those records.
Right.
Put that information in the hands of the clinics as well, so that they can also help provide better care to this patient.
Yeah.
So we're trying to bring clarity and personalization to each patient. So all around, the overall objective is to make the process a little bit simpler all around.
That's awesome. Now, where do patients go to get on this wait list if they want?
So they can just go to our website, MyStoria.com, and then you'll get an email right away, and that will give you access into the community as well. So you can access that right away. We opened the wait list for this year just to give somewhere for people to go and express interest, and then we created the community so we could provide an offer right off the bat to people who were looking for support. So that was kind of the easiest way to get people together and talking, and Carly to be able to contribute help and insight and education to them before we're ready to launch the platform.
That's awesome. So you mentioned your team. So there's I guess this is gonna be a big part of it and a growing part of the team, right? You're gonna have to keep adding people to be able to manage these
Yeah,
files
exactly.
and the 800 pages of analysis, right?
Every page, I went through it, I sorted it, I did it, because
You are my
that's-
hero, let me just say right now, that's amazing, yeah.
Well, I was like, let me do this for you, I can help you, because can you imagine how overwhelmed, you would be?
Yeah.
So I was like, I got this, I got you, don't worry, this is my job, let me work my magic and see what I can do for you, and I did it.
It's amazing, I find too, that, you pick up on details when you get another set of eyes looking at things that you wouldn't necessarily pick up on if it's only one person. So while I was in Brussels, there was a couple there that met with me, and I'd actually met them in Berlin the year before at the same meeting. And they were quite desperate, and I got their whole history, and she had done 18 egg retrievals.
Oh, wow.
18. And I said, wow, that's just devastating no matter what. Financially, emotionally, medically, physically, just exhausting, right? 18, I mean, even from the physician side, I'd be exhausted doing 18. I mean, mentally, I'd be tortured thinking, this isn't working, and I'm just taking money from these people for no reason, yeah. And they had, of course, gone to a bunch of different clinics hoping to find, an answer to their problems. And so they gave me their data, and I stayed up till 2 a.m. looking at it, and I realized, there were things I would at least have done differently. Their stimulations were really long. We know that's bad for egg quality. Their dosages, in this case, shockingly, this being Europe, they tend to underdose people. North America, we tend to overdose. Europe tends to underdose. And so I said, she had actually really good AMH despite being slightly older for a fertility patient. And instead of getting kind of a medium dose, they were giving her 100 units a day, which is nothing for someone that's 42. So it just made no sense. And so I sat down with them. I left them at the end of my consult day, and I said, let's just spend an hour together and pour through everything. And when you actually show people the data, which is the nice thing about having it online, I think too, when they can actually see the raw information there, and you can point things out either on a graph or a chart or a timeline that you have, I think that makes a huge difference for people to relook at it and say, oh, okay, now I get it. And it also makes it easier to educate the patients about things, because you can say, look, your stim took 14 days, and we know that once it's past 12, the egg quality starts to plummet. So I think people will be able to learn about that. I also have to say that as someone that really values excellence in fertility care, I can't lie, I think it kind of puts the onus on the fertility clinics to do better, right? We have to be that much more responsible, knowing people are going to be out there, sort of double checking what happens.
Being able to find legitimate support and education too, right? So again, you're going to Reddit, you're going to Facebook. If you bring that to your clinic and you just say, oh, I found this information on Reddit, you're going to get pushed aside, right? Yeah. So again, we're trying to also put legitimate information that can be backed up with scientific medical data, so that they're taken seriously when they go to the clinics.
For sure. I mean, I do always have to get a good dose of Dr. Google every day from my patients, because they'll come in and saying, I read this. I'm like, no, that's not true. Here's the actual evidence. But you're absolutely right. I mean, it depends on the source and where the information is coming from. When we were chatting before the show started, you had talked about the importance of root causes. Do you want to chat about that for a second?
Yeah, I get really frustrated because I think root causes are really important, and I hear a lot from fertility patients that, oh, well, the doctor told me it doesn't really matter, what the root cause is, what matters is that I get pregnant. And I just think to myself, well, there's not 100% chance that every single person is going to walk out with baby in hand. But to then spend years and your life savings on fertility treatment at the end, potentially walk out with no baby, no diagnosis, no money, no nothing, you're just left wondering what happened.
Right.
And it's if you could walk out and say, okay, maybe things didn't work out for me, but it's because of this. This is the reason. This is the cause, and I need to do A, B, C, and D to manage my health. And I've learned so much about my body through this journey. Like, at least that would be better. Or can you find the root cause and then actually treat it because you know what is wrong? And then here comes baby. Like, I'm just like, how can anyone say it doesn't matter what the root cause is and just let someone do cycle after cycle? Doesn't it make more sense to take time at the beginning, maybe do a little bit more testing, figure out exactly what is going on, or if you try a couple cycles, say, okay, let's stop for a second. We need to investigate more so that you can tailor a care plan exactly to that person and what they need.
Yeah.
Like, it's not just, oh, let's just keep throwing stuff against the wall until something sticks. Like, you know? Like,
We've used that phrase on the show a lot,
what's
actually.
going on?
Yeah, for sure. I mean, it's so true that the root cause part of things gets missed all the time. I find, like, it's very common. I had a fertility coach reach out to me today to tell me that another clinic, and we never name clinics, of course, here, but another clinic had said it doesn't matter what's wrong as long as her tubes are open. Try letrozole for 4 to 6 months and just see what happens. And I was like, that's absolutely useless. Like, people with unexplained infertility have a 3.7% chance with letrozole. People with unexplained infertility have between a 3.1 to 4.3% chance if they don't take letrozole, which averages out to roughly 3.6. And so they've got the exact same chance with or without the pill. Why would you torture people and waste 6 months of their time with that? Like, I'm all fine with offering people whatever you think may work, even if it's not correct. But as a physician, you can offer whatever you want to people, but you've got to at least offer them options.
Yeah.
To tell people to go, do 6 months of natural cycle monitoring so that you can bill OHIP for it, and it's lucrative. And then not do anything, give them a 0.1% increase in success rate. Like, that doesn't make any sense to me. So I agree, like, finding the root cause is absolutely critical. And a lot of times I feel in the fertility world, what ends up happening is people do some superficial tests, and then they basically say your tubes are open, you should do IUI. Or your AMH is quote unquote low, which it often actually isn't, you need IVF right away, the minute you've walked through the door. And then before you've even had a chance to know what's wrong with you, or how you can fix it with the root cause analysis, you're actually doing treatments and you don't even know why you need that treatment. And I get it because people come to us a lot for second opinions. And then I have to ask them, like, what did they, it's always my first question. You've already had fertility investigations. Yes. What did they tell you was wrong? I don't know.
Mm-hmm.
And so many people say that, and then I'm just sitting there going, wow, you've spent 20, 30, 50, sometimes $100,000 on treatment, and they didn't even know what was wrong.
How many of those people do you find either have endo or something going on like immunological?
A lot.
Right.
So we are known kind of for our endo work, and so there's a really good study that came out a few months ago which showed that 44% of all patients with unexplained infertility actually have endometriosis when they take them to surgery and look. And so, I mean, that's a staggering number, right? And then you get the whole cadre of people that say, well, endo doesn't matter. Well, of course it matters. That's why they're infertile to begin with, right? And simply doing IVF doesn't necessarily fix that, nor is it always even necessary, right? Surgery can be beneficial. IUI can sometimes work. You don't have to jump into IVF just because you have endo. And again, I think having a platform where people can share that, someone can look at it, is a great opportunity to intervene and say, do you know you have options? So I love that about this opportunity for people. I think it's going to be huge in that regard. And I think people deserve that. And funding for IVF is hopefully increasing. We don't have any specifics yet, but with that coming, it's going to be even easier for more people to access care. But I don't think we want to railroad people into IVF cycles when we still don't know what's wrong with them. It's great that it's available and accessible, but not everybody needs it. And so I think we do have to be kind of careful about that. It'd be great to give people answers because even if it's not, costing them as much, there's still costs, the drugs, genetic testing potentially,
Definitely.
travel, time off work, all these things that have associated costs, emotional costs, mental costs, relationship costs.
Yeah.
And then if it doesn't work, you still have paid that price. And even if it didn't come out of your bank account, there's still a lot to it.
Oh, yeah, or if you're, living with like recurrent implantation failure, and then there's like, a whole wall of emotions and things that go along with that, and then like all the other testing that you may possibly need to go through, and it's like, people don't know about those things. Nobody ever thinks about that. I think, the doctor said I can do IVF, it's gonna work, I'm gonna get all these embryos, and I'm gonna be able to have like so many babies, and it's like, well, that's not necessarily always true.
Right. T, do we have questions?
You have questions related to MyStoria.
Well, Carly may want to take a crack at some of the fertility questions.
Yeah, sure. Why not? Why not?
She may, so we can see what she thinks. So you're thinking early 2025 for the rollout of this?
If not sooner, but
Most likely.
early 20.
Yeah.
Yeah.
Okay.
Yeah, we've got another group of testers to get in there and very, very soon.
Work out the bugs.
Get some other feedback.
What's the
from some of
feedback
our
now from the
testers.
people that have done it so far?
So far, we've heard amazing feedback. Like I said, we've got 10 in there, and we've had multiple people who have either had issues identified that they need to go and speak to their doctors about. We've saved them a significant amount of money.
Yeah, loving the content and the education, like, wow, I didn't even know that, I didn't think about that, this is so great. How valuable it would be for people at the beginning of their journey as well. Sometimes when years down the road, there's some things but they're still even learning things that they didn't know, and they've been doing years, some of them. So finding value for people across the board, multiple points of their journey as well.
And the questionnaire on the onboarding portion of the experience is very extensive. It's going to take you time. Pour a coffee, pour a glass of wine, whatever your thing is.
No wine.
Yes, I know. To sit down and go through, it's going to take you time, but the feedback has been that, the testers appreciate how robust it is, how thoughtful it is, how much education there is, how science-backed it is. We know there's solutions out on the market that don't quite do what we do, but maybe they ask you 8 questions and then they're telling you what your protocol should be. How is that possibly something that can even be accurate, right? So, there are some predatory type offers out there. I think a lot of us kind of get targeted with a lot of these ads on Facebook and Instagram, and we're really trying to help people cut through that and provide value in what we're doing. So yeah, so far the feedback has been amazing. So really validating.
Like, I'm never going to tell someone this is what your protocol should be. I'm never going to tell someone, well, if you do this in the next few months, you have this percentage chance of getting pregnant. I'm never going to say that because I don't know that. One, I'm not a doctor. And 2, I don't even think a doctor could say, if you do this in the next month or 2, you have 75% chance of getting pregnant. Nobody can know that for sure. And there's things out there, and they're saying these 6 things to people, and it's giving false hope, it's giving misinformation, and I don't like that. I think one thing about MyStoria is we're for real, we're authentic. I'm not always going to tell you what you want to hear, but I'm going to tell you what you need to hear. I'm going to give it to people real. I'm going to tell them, I'm going to treat everyone. If it was me, what would I want someone to tell me? What would I do? Everyone's important. Everyone's story matters across the board to me.
That's awesome. I love that. T, can we take some questions?
There was one comment I got here. I'm pretty sure Carly was my nurse at Trio in Kitchener-Waterloo.
Cannot confirm or deny if they were patient, but yeah.
Well, you do come from a nursing background.
I do come from a nursing background.
Yeah. You said you started in 2006 in nursing?
In nursing in general, yeah, and then doing fertility since 2018.
2018.
Yeah.
Cool.
So I've been around the block a little bit, worked in a few different areas of medicine, so I think that helps me, nursing in general. I've seen, right from the very beginning of life, and I've been there right at the very end, so, health across the lifespan. So I think that allows me to draw on multiple things that I've learned throughout my nursing career.
Yeah, that's amazing. Yeah. It's great when you have that kind of wealth of knowledge and background experience to be able to talk about it.
I have some regarding supplements.
Yeah, sure.
So one of the questions also is, do you provide feedback on supplements as well? I find many clinics/doctors want to comment on natural supplements.
I mean, I think sometimes it depends on what the supplement is. Like, I have to kind of talk to that person and say, okay, what are you taking? Some things I might be able to comment on, some things I might be able to check with our advisory board on our naturopath and kind of see their opinion. Sometimes, like, if I think something's like flat out wrong, I would say no, like that's completely unnecessary. Like, you don't need to take these 20 supplements. Like, right away, that's a lot. Like, that's insane, you know. And I think there's a handful of supplements that I think most people could generally benefit from, even whether they're fertility or not. I think are good for people's health. Quality of supplements, I think, matters. So yeah, I think it's an individualized case, but I would, depending on what it was. But I'm definitely careful, as I'm not a complete expert in supplements, but I think there's just something that we all know, or like in the fertility world, like common sense.
Well, I've found over the years that as physicians, we do actually a pretty poor job of knowing this stuff about the supplements, the information, and the data. So I kind of made it my own mission to make sure I learned about it. So we have a naturopath at every single site that we have, and I actually listen to them. I talk to them. I learn about what they believe in and why they believe in it. And then I did my own research. So I would dive into the data. We've presented studies on the show. Just recently, for example, for people that had subchorionic hemorrhage, we learned that a supplement called alpha lipoic acid, or ALA, actually reduces the duration and intensity of the bleed, probably reduces miscarriages, reduces pain. And so now, like when I'm on call in the hospital, I'm actually prescribing people a supplement, which I've never done in my entire career. So I do feel that we don't know some basic information that we actually should, even though it's not kind of traditional Western medicine, but it's valid. It's, you know, randomized controlled trial data. We don't pay attention to it enough. So I actually do think doctors and fertility teams need to do a better job of dealing with the supplement part of thing, because it is important. And you're right, there are patients that come in and, you know, I'll say, are you taking any meds? And they go, no. And I go, any supplements? And like, I can't keep up typing. I type pretty quickly, but they're going so fast. Telling me, I take PPQ or PQQ. I'm taking, you know, NAC. I'm taking Nostol. I'm taking this, that, and then before you know it, like it's like 2 lines of their chart already occupied, and you can actually be damaging the egg and sperm quality by doing that too.
Yeah, I think people don't realize like the contraindications. That there's medications that contraindicate each other, supplements that contraindicate, and there's also supplements and medications that contraindicate each other. And it's like, that's why you need to tell your doctor everything you're taking, and you need to tell your naturopath everything you're taking. Like, individualized supplementation is important if you're going to take multiple things, because you need to know what you're taking, those contraindications, and do you really need everything that you're taking, you know?
For sure.
I think when I went to a conference, they were talking a little bit about supplements, and a lot of it was, oh, we don't know, and there's not the research. But they're saying there's not research because they're trying to link all the research to like live birth rates.
Yeah.
And I'm like, that's not ideal. Like, there's not going to be a lot of research about omega-3 and live birth rates. But it's like, if you look at the other research on some of these supplements, the benefits to your overall health, or things, it's like, well, if you fix all of that and you're super healthy, you're going to have a higher chance of being able to conceive. So I'm like, to me, I think on some of these things, we need to expand our minds a little bit and be more open-minded.
Yeah, and I mean, there's no question that naturopathy is important, and there's tons of data out there for it. Again, as Western medicine doctors, we're not very good at understanding that stuff. And a lot of time it's kind of put down, right? Like, you'll hear a lot of fertility specialists say, well, that stuff doesn't matter, it's not important, or it doesn't have any validity, but they're actually wrong. Like, there is randomized controlled trial evidence that it works. How are you going to argue with an RCT? So yeah, I do think that's important. More questions?
Of course. Dr. B and T, what do you recommend for probiotic supplementation when on multiple antibiotics?
Probiotic supplementation when you're on while an oral and a vaginal probiotic if they're on multiple antibiotics. So there are multiple different ones. If you're on multiple antibiotics, the really high potency ones are the best. So I think there's one called Probaclac. Don't quote me on that. It's like a 50 billion dose of lactobacillus. So we usually will tell people to use one really strong. I don't know if you guys when you were doing fertility nursing, was that a thing there?
No, naturopath.
They would do it all?
Yeah,
Yeah.
anything to do with supplementation, stuff like that, they're really good at.
So the fertility world, as it gets more individualized, one of the things that's come up is that the vaginal and uterine microbiome, and probably the gut as well, are actually quite important to the outcomes. Most of us know nothing about that. It's just not anything we ever trained for. In fact, I don't think I learned the word microbiome until a couple of years ago when I started delving into this stuff. It just wasn't part of our training at all. And so as that grows and becomes more important, again, it's like incumbent on us to learn about this stuff, which is a great, another great kind of aspect to having a platform where people that are aware of the latest and greatest are there to say, have you thought of this, right? Because now we can test for the microbiome. You can treat for the microbiome. And that's why people are often on lots of antibiotics now to treat it, because we do that to many of our patients. We actually test them, find out what's wrong. I had a patient who's at another clinic, and I spoke to them and I said, they had tried multiple embryo transfers with no success. And I said, well, what have they done? And they said, well, they gave me intralipids. I was like, okay. And did they do anything else? They gave me steroids. Okay. Any testing? No. So you don't actually know why you're on steroids and intralipids. Like they had no idea. And so we just got our test results back because I had recommended it and found out that like the microbiome was horrendous. She had no lactobacillus, which is the number one predictor of failure. So these are the kinds of things where if it's there, available for another set of eyes to see, and you're a bit more aware and open, you might actually be able to find all those little nuances, which again take you from here's my average success rate to now I'm actually successful. So I really like that about the
I definitely put some stuff about the microbiome because I've been diving deep. I'm all about the microbiome right now. So in the platform, I actually provide education about gut, vaginal, endo, about that stuff. Yeah, and like looking into it. And it's like, it's true. It's like, it starts with what you're putting in your body. I mean,
for sure.
Reading about the microbiome, I started thinking, when you do fertility treatment for a long time, when you're using a lot of vaginal, medications, sometimes these procedures are really invasive, and it's like, could we be having an effect? Is there a possibility on the microbiome over time? And is that something, that maybe when somebody's starting fertility treatment or they've been at it for a while, it's like even just their vaginal microbiome, should this be something that should be looked at more routinely, doing more testing to see, hey, has something changed? Maybe it was good before, maybe it's not anymore. Like, I don't know, I feel like there's a certain sort of onus that needs to happen on doctors say, hey, man, we need to think about that and test it because it could have been affected before, or have we affected it? Has something changed? Like,
I can tell you as someone that's a firm believer in the value of the microbiome, that the vast majority of fertility specialists across North America have no clue about it. Like none. It's off the radar completely. They just don't think it's important, or they haven't read enough about it. And I mean, there are literally dozens and dozens of studies now showing how important it is. There's less on treatment. So we're not sure what to do when we find out you do have an imbalance, or what we call a dysbiosis. But there's no question that the imbalance itself predicts failure. So naturally, you would think if you can't correct it, it should fix it. But we just don't have that data yet. And because that's not there, people are like, well, this is all fake. There's a company we use out of Greece called Fertility, and another clinic told their patient that it was a money grab. Our success rate after treating for what we found from Fertility is 91%.
wow.
Right? Like, I've never heard of any clinic anywhere that has that kind of success rate. So these aren't people that failed. We did the test. We fixed what we found that was wrong. and they were getting a 91% success rate. So
Yeah, I
like,
don't even know how you argue with that, honestly, at that point.
yeah.
So if people want to do Fertility themselves, how do they do it?
You can actually just go straight to Fertility, go to their website. It's fertilysys.com. Their tests are all there. You can order it and they'll ship it to you. We have a bundle with them called Victory Panel 1 and Victory Panel 2. So if you're my patient, they'll actually give you a discount and then they send the results to me and I help the patients work through it. Mainly because I was one of the key people that sort of put them on the map, and so they give our patients a break because of that. But you can access it easily for anyone, and it's probably the cheapest microbiome test I'm aware of. I think there are some newer ones coming out of the UK, which are also really inexpensive. I just haven't had a lot of experience with them. I love these guys. We've been working together for a while.
So if you're getting 91% success rate,
Right.
why change?
Right before the Canadian Fertility Show last year, we did some research in-house, looked at all the cases we had done. And we had 49 at that point where we had done the test, found out what was wrong, treated them, and then retransferred. And 45 of the 49 got pregnant.
That's amazing.
Yeah, I mean, mind blowing, right? Like, no one gets those success rates. I never in my life thought I'd get a 91% success rate. Like, we have very, very good success rates, and they're close to that. But in someone that's failed before once or twice, you're expecting to get like a 50% success rate, 40% success rate, and that's if you're really good. 91, unheard of. So there's obviously something there, and I think it's a shame that people don't know about it. So it's great, again, that MyStoria is kind of championing these other parts of this, because that's what people need to hear. That's what they need to learn.
Yeah, it's multifaceted.
I love that. That's a big part of why I was
Question for
part of
Carly.
MyStoria. Yeah, question for Carly.
Yeah, I was wondering how far along a pregnancy would MyStoria support go? Past graduation from a fertility clinic, during that scary time before you go get an OB and don't know what to do or advocate for?
Yeah, I mean, I think we could support people through their whole pregnancy. I do have someone on my team who has labor and delivery training. So, I'm trying to grow my team and get people with different levels of experience so that we can absolutely do that the whole way, and you could continue to really upload like your ultrasounds, your medical records throughout, so you can keep tracking your journey all the way until you get to baby. Why not? Use it the whole time. Yeah.
The story doesn't really end, does it?
That's right.
Yeah,
It's constantly growing and evolving.
that's great.
And I would love that too, because that's one of the sad parts sometimes about fertility. So you see people and they're like, oh, I was used to seeing these people for 6 months and now they're gone. You're happy for them that they're gone. And sometimes if you're lucky, they'll pop in and visit. But that would be great with MyStoria is, if I was supporting someone this whole time and then they just left, I would love to support them if you can.
Yeah, the continuity of care is awesome. I still deliver babies. So when we get patients pregnant here and they live locally, I'll actually see them for their obstetrical care. And which makes it great. And then sometimes I'm delivering their babies for them as well. So it's amazing. I remember them as an embryo transfer, and then I actually get to take this little bundle of joy and hand it to people. Yeah. And then I tell them to name their baby Victoria.
I love the full circle moment.
Yeah, it's great because, when you can be there to support people through the whole journey, it does make it even that much more rewarding, for sure.
Hi there, what is your recommendation on decreasing fibroid, 7-centimeter fibroid in the posterior uterus trying for pregnancy? IUI has been unsuccessful, unfortunately.
What's my recommendation on decreasing it?
Yeah.
7-centimeter fibroid, that's surgery. You can't decrease a 7-centimeter fibroid. 7-centimeter fibroid is big enough that the data actually suggests it should be removed. Anything over 4 will have some impact on the pregnancy. So the current recommendations are they actually be removed at that size. You can shrink them with medications, but the problem is that medications give you a 50% volume shrinkage, which takes a 7-centimeter fibroid and makes it 5.2 off the top of my head. So it's still a huge fibroid. Yeah, so something like that, that's someone that needs surgery and they're going to need to deal with it through that. I guess that's again something that they'd be able to put out there, and you guys would either talk to them about it or get one of us to kind of comment
Dr.
on it.
Vickery.
Yeah, Rocky, I need you.
Kind of fun question that's good for everybody. I've heard of people finding out that they have an infection in their uterus and being prescribed an AVX, and then after having successful pregnancy, how do you know you have a uterine infection?
Well, that would be the microbiome testing we were talking about. So there are different companies and there are different approaches. Some people do a vaginal swab and a menstrual blood collection, which is what Fertility does, and I love that because it's painless. And some companies do an endometrial biopsy, which is horrifically uncomfortable for everyone that's ever had one. Even when you do it the most gentle way, it still sucks. So the one that's available in Canada is done by biopsy. And then if you're getting it from overseas, you can do the menstrual blood test. I don't believe there's anyone in Canada doing menstrual blood, but that's how you do the test. So we use the company called Fertility. I don't care what company people use, but I find them the most reliable. The other company that's available, I have seen too many questionable reports for me to feel comfortable with them, where they say that there's absolutely no bacteria. So they actually found nothing, no good bacteria, no bad bacteria. And I actually just recently emailed them and said, that doesn't make sense. There has to be something there. And they said, no, you can just have nothing. And I said, no, that's actually not possible. Yeah, so I don't think it's a valid test platform, but we've been very happy with Fertility. I can't say I love the fact that you can't cure all the patients. Sometimes we really find it hard to correct the microbiome. It's a bit of a battle, but in general, at least we get the results we can interpret and then, make decisions based on that testing.
Fertility doctor, so this is the patient with the fibroid?
Yeah.
Fertility doctors working with IVF even with the 7 centimeter fibroid.
Recommending IVF even with the 7 centimeter fibroid. Ching. Yeah, I would recommend they have surgery. Yeah. Yeah. What would they have done in the previous clinic you were at?
I think you would have recommended surgery. I mean, I remember having, we had an entire list that I used in a picture, and it showed like fibroids and where they were in the uterus and the sizes. And I was like, this is when you must have surgery.
Yeah.
So, and obviously the doctor would always talk to the patient about that, but just like we had that as reference, so we knew if they had follow-up questions.
Yeah. Yeah, it's, again, it's amazing, like things like endo, things like fibroids, because the wait list is so long in Canada and Ontario for sure, to get a surgical intervention, it sometimes gets kind of brushed aside and you're pushed into doing IVF with the hopes that this will overcome the endo or overcome the fibroid. And it might, I mean, you might get lucky and it works, but oftentimes it doesn't. So I think there's kind of two schools of thought. One is, well, why don't you just try the IVF and then see what happens? And if it doesn't work, you can always do IVF again after you've fixed it.
Mm-hmm.
And then the other, and then the other school of thought is, let's optimize this. And I'm personally much more a fan of the let's optimize this than I am of the idea that you should just tell people to do it again. I think that's, hurtful. Financially, emotionally, mentally, all of those things, right? And people don't realize how much of a toll it takes, even on something as elemental as a relationship, right? Your sex life changes, your intimacy changes, your support for one another changes. I mean, lots of people have relationships that dissolve as a result of their infertility struggles. So, shouldn't we maximize the success every time?
I think so. And you could wait like a year and a half just for on the funded IVF wait list. So it's like at the same time, a referral can be sent to see a surgeon, and then if it comes around the same time, you can always just defer.
Right.
Funded cycle, get your surgery, then have a better chance of still your funded IVF.
And again, even when the funding's available, while it reduces costs, it doesn't eliminate costs. And so I'm always saying to patients that come to us, because we get lots of patients that say like, I'm ready, let's go. I want to make this happen today. Can I start tomorrow? And I always say no. And I tell everybody, rushing fertility is a really good way to make me rich and make you poor, because we're not optimizing. And if we don't optimize, you're just getting the same care you do everywhere else. And I don't want to be everybody else. I want to be different. I want to be better. So I think you need to kind of slow down sometimes, find the root causes, figure out the right supplements, optimize the microbiome, clear out the endo, get rid of the fibroids. And then people get pregnant all the time. Because I do my own surgery, I've lost track of how many patients got pregnant when I had told them, you need surgery in order to optimize potential IVF. I did the surgery and then they got pregnant before we ever got to IVF. Right? Yeah, I mean, it's great. And I've said many times before, and I wish this would catch on, but I guess it never will for whatever reason. But really being good at fertility is not doing IVF. Like anybody can do IVF and anybody can be decent at it, and some people are great at it, right? Like it's not hard. Doing an egg retrieval, I could probably train a monkey to do. It's not a difficult thing. The lab, sure, they have to be very skilled, but it's not like there aren't skilled embryologists in there. And an embryo transfer, I mean, literally anybody could do an embryo transfer. It's an easy thing to do. So being great at IVF, honestly, that's easy. Getting people pregnant who have infertility without doing IVF, that's where it's difficult. And I think the better you are at doing that, the better you are as a fertility specialist. But for some reason, the fertility world thinks that the better you are at IVF, the better you are as a fertility specialist, which is just not the case, at least in my head. But yeah.
You have to find yourself in the puzzle.
Right. Yeah. Exactly. Yeah. And I guess, again, like that's part of what we're going to get from you guys is being able to see the puzzle and then solve the puzzle, which is fabulous. Are we at 9?
9:06.
9:06. Okay, we should probably wind it down. For all those of you that asked questions and we didn't get to tonight, I'm sorry, I was dazzled by our charming guests. So we will get to you. I don't know, do you want to do a show on the weekend or something?
Yeah.
Do you have time?
Yeah, I got time.
Okay, we'll do a Saturday night show for you guys, and we'll get to all the questions. But thank you for joining us. Thank you both for coming. And our scoundrel of an assistant, Haley, who is off camera, who should have been here on with us, Haley, but didn't decide to come on the show. So thank you so much for making the trip out here. Sorry for the glitches at the start, but it seems to have run smoothly thereafter. And we'll look forward. So you're going to let us know and we'll post it.
Yeah, absolutely.
On all our social media and chat about this. And if people have questions, it's MyStoria, MyStoria.com.
Yes.
Right? And they can sign up there right now for the waitlist.
For the waitlist, yeah. And then you'll get early access.
Oh, awesome. Okay, amazing.
People are wondering what time on Saturday. They're already asking.
Hey man, that's up to you. What time do you want to do it?
Whatever. I'm good. I'm here.
8?
Okay. 8 p.m.
Like normal? But we'll do it at 8?
On Saturday, sure. Yeah, let's do it.
Or we could do 7 and we could catch a movie.
I'm all for watching.
Let's do 7.
7 o'clock.
7 o'clock, folks. All right. So we will see you Saturday and then again next Tuesday.
Correct.
Fertility Fact or Fiction. Thank you for joining us.